Hello, it's Kristy Bird MaKieve. I'm the CEO of Healthy Rural California. We are a nonprofit consortium model for a sponsoring institution accredited by ACGME to develop new residency programs. You may be seeing this video and already know that we are on the path to have our first cohort of psychiatry residents to start next June 2024. And so this video is a request specifically to our counties in the North State, requesting to consider MHSA funding to support Healthy Rural California's psychiatry residency. So let me give you a quick background of how we got here today. It's November 21st, 2023. And we created Healthy Rural California in January 2020. We got IRS approval only 3 years ago. And quickly in the next few months after that, had a feasibility study that said, yes, there is a psychiatry residency that's viable in this region centered in Chico. And that it should be a consortium model just because of all the requirements, the 4-year curriculum for psychiatry residency as per ACGME guidelines is a really hefty lift. And at the time that we were developing in 2021 and 2022, there were no child and adolescent psychiatrists in Butte County. Also, the hospitals locally were not quite ready to step into GME, and they may not even have enough robust services necessarily. Some do, some don't. And so we ended up partnering with the VA of Northern California in Sacramento, as well as UC Davis School of Medicine, an esteemed academic institution that will provide, those two will be providing the first year of the curriculum in the Sacramento region for our curriculum. The second year, the residents will be partially in the Yuba City, Marysville area, predominantly with Ampla Health, but also very good partners with the Sutter Yuba Behavioral Health Department. And then the residents will spend their continuity clinic or third year in Butte County with the Butte County Behavioral Health. The electives in fourth year could span Tehama County, Glenn County. There's a lot of different ways that the electives could be more spread out through the region. Predominantly, the ACGME requires that the residents travel within 1 hour of Chico, which is where we're centered, other than living in Sacramento for that first year. And so we're seeking funding. We will be using Teaching Health Center funding, which is basically through the federal government. We have to apply for it every year as it stands now. It's a grant, but it's only $160,000 per year per resident. Residents, and there's no cost of living increase. So the cost of inflation, residents are demanding higher and higher salaries. And so we're seeking funding to help bridge that gap so that the $160,000 doesn't limit what we should be doing with these residents or limiting the residents' experience as well. We have to be competitive. We did have more than 500 applications for this first cohort. Looking forward to celebrating March 15th with you in 2024. That will be when when the match day is nationally, and we'll hear what the first cohort will be. And then they'll actually start in the residency program in June of that year. So pretty quick, they have to change their whole lives and relocate that in just a few months. But that's what all the residents do. It is a national effort. And we're super thrilled and excited about next spring. So I hope that you can consider working with your MHSA steering committee. I don't know, reach out to me, Kristy, or to Lena or Elisa for the program coordinators of these residency programs, because we're willing to be creative. Maybe you have a county budget where you can allocate some funds to Healthy Rural California every year. Maybe it's a one-time innovation grant. I'm not quite sure about MHSA. We're willing to go to MHSA and have these conversations at that state level. Anything that we can do. It is unfortunate. The state has really put an emphasis on graduate medical education, and I am hearing that psychiatry residency programs are becoming more, there'll be more funding available for psychiatry residency programs. And I'm not quite sure if that'll be through MHSA or perhaps through HCI, but we are definitely needing to just be creative and innovative to see what we can do to make sure that this psychiatry is really a community psychiatry residency with an interesting and innovative model is fundable and sustainable. What it's going to do as a return on that investment is help recruit those psychiatrists to the counties or to the entities in the county that would need those psychiatrists. So it's a very good return on your investment to consider funding Healthy Rural California in this project, ongoing program, I should say. And so I just welcome any suggestions or thoughts that you might have. We would be willing to come and speak to your entity to discuss this in greater detail. And then I don't want to forget, so I'm going to say this now, we're also in the process of launching a family medicine residency to be centered here in Chico through Healthy Rural California. There are 2 family medicine residencies in Redding. They just also launched an internal medicine residency at Shasta Regional Medical Center. And so why am I mentioning primary care? Well, integrated behavioral health is also becoming very, very important. So if your county is also going, well, we need primary care docs more than we need psychiatrists, well, this funding could also be useful. For those not in the know, I'm sure that everybody knows this, but I'm just going to say it anyway. Psychiatry and primary care, internal medicine and family medicine have always been separate. And those 2 specialties have gone, they're separate ways. And so you have to have a psychiatrist and a family medicine doctor in order to provide behavioral and mental health services, right? However, the primary care physicians are stepping more into that space, probably due to the lack of psychiatrists. And so there's a lot more prescription writing from the internal medicine and family medicine physicians. So it is important to also consider that we're launching that family medicine residency. Really hope to get accredited in January 2024. And then we've also sought funding to launch an internal medicine residency. Both of those are with Enloe Medical Center and Northern Valley Indian Health, as well as the VA. And so it's all needed. And so the funding will go a long way. And so if MHSA is only thinking of mental behavioral health, let's talk about how the integrated behavioral health is also something that might be applicable for funding. So happy to talk to you. I'm Kristy. Email me really is the best way at MaKieve, MAKIEVE at Healthy Rural CA as in California.org. So thank you so much for listening to this, and please do ask questions. Have a wonderful Thanksgiving, and thank you for all that you do.